So hi guys, my name's Kaynen. I live in Las Vegas. I'm an ER nurse here in Las Vegas. I've been practicing for a little over 2 years now. And big question that a lot of people ask me is going to PA school. So I'm one of the nurses that are attending PA school this fall. So that's kind of why we're doing this interview. If you guys can get some information on that.
Yes, this was a much requested topic. Is there anyone out there who is a nurse who's decided to go the PA route instead of the NP route? So I'm interested to kind of hear your why and how you got to this point. But to back it up a little bit, kind of where did your interest in medicine come? What led you to becoming a nurse?
Good question. So my interest came at the end of freshman year of college. I kind of moved from Las Vegas to Washington State for freshman year. My family's from Washington. And my aunt, she's actually a PA right now, practices in emergency medicine up there. And I was kind of doing the whole police route. That was kind of my career goal at the time. Suffered an injury, and when I had that injury, I kind of didn't have anything to do for about 2 months because I was used to riding with the police department when I wasn't at school. And my aunt said, "Hey, why don't you come shadow me in the hospital, see if you like it." So I did, and absolutely fell in love with it. So my aunt's actually a PA. She's been doing that for a little over 20 years now, but she was an ER nurse before she went to PA school. So the whole idea behind my route is definitely coming from her.
Okay, cool. So what were you studying in school before then? Did you kind of switch it up after that, or made a transition?
Psychology at the time.
Gotcha.
Psychology was my major. Yeah, I had to kind of switch that up after a year and a half.
Okay. So was your goal the whole time to kind of emulate what she had done and do nursing and then PA, or how did that decision to kind of further your education come into play?
I think it was a small part of it. I think I had a small part in the back of my mind that I might end up doing this entire route. At first, I definitely just wanted to do the nursing thing. I didn't think I was smart enough to do nursing, or let alone go into medicine. So I had it in the back of my mind, but I didn't actually think I was going to be able to do it. And so first I said, you know what, I'll apply to nursing school. I'll do that route first. And so I moved back to Las Vegas, changed my major, started doing all the prerequisite courses that I needed in order to apply to nursing school. And kind of started realizing, I can do this, because I didn't do very well in high school. I graduated with a very low GPA and didn't really apply myself. And so, once I started to see that, hey, if I pay attention and, do what I'm supposed to do, I can actually do pretty well in these courses. So once I found out that I can get into nursing school, I got accepted, and I said, you know what, I think I can probably apply to PA school here soon too. So.
Okay. How long have you been a nurse?
A little over 2 years. So I graduated college December of 2017. Been practicing since January of 2018.
Okay. One of the questions I get a lot is about choosing nursing as a major for PA school. It's great experience, of course, but did your education that you got from being a nurse fulfill everything you needed for PA school, or did you have to kind of do some extra stuff?
I had to do some extra stuff.
Okay.
Depending on the school and the part of the country you're going to school at, obviously the PA schools you're applying to, their requirements are so different. But I did have to take a year of general chemistry because the nursing chemistry they required was kind of an introductory chemistry course. And then I had to take a semester of general biology. And luckily, most of the schools I applied to didn't require organic chemistry, so I didn't have to do that.
Nice.
But so I had to take 3 extra courses.
Okay, and you did those while you were working?
Yes, I did the 2 chemistry courses I did while I was working, and then the biology course I did it in the summer of nursing school.
Okay, cool.
The summer break, yeah.
Gotcha. So let's talk about your kind of job now, and then we'll talk more about becoming a PA. But just so people understand, because I feel like there's a lot of misconception about, there's just a lot of different types of nurses. So can you break down for us, and I know you do this great on your YouTube channel, but can you give us a little breakdown of just kind of the different nursing degrees, what each entails a little bit, and what you do?
So there are different nursing degrees. There's a 2-year associate degree nursing degree, and then there's a 4-year BSN degree. That's the one that I have. Both do the same job. They both get jobs in the same areas. The pay is pretty much the exact same. The only difference is they're starting to push more towards, obviously, higher educated nurses, so baccalaureate degree nurses. And that's sort of the plan, is that they would have 80% of the workforce be BSN educated by 2020, which I'm not sure if they made that goal. But So yeah, the positions are the exact same. The only difference is the level of education that they have. I know PAs, kind of back in the day, they could have bachelor's degrees.
Yeah.
And so obviously, academic inflation, we're increasing the level of education everyone needs and things like that. And so the job is the exact same, but those are the two routes you can do. So I did 2 years of prerequisite courses, then applied to nursing school and did 2 more years for a total of 4. And right now I work in the emergency department. I do work with associate degree nurses that work in the emergency department too. A lot of them are a little older, so they're the nurses that have been working for 20, 30 years. And my job in the ER is to see and assess emergent patients, along with some of the ER doctors, PAs, and NPs. And we see both emergent and non-emergent patients. Sometimes they're urgent care patients and or primary care patients. And we assess them, find out what's going on, get a diagnosis, treat that, and then send them upstairs to either be admitted or maybe to surgery if it's that emergent, which happens sometimes.
Being a nurse right now and pursuing PA, are there any ways that you feel limited in your position? I guess my question is, what will becoming a PA kind of fulfill for you that you're not able to do right now?
Right. That's a great question.
Sorry, you probably feel like you're back at PA school interviews or something.
It'll be able to fill 1, a level of autonomy, and 2, a level of treating patients that I can't do right now. So the good thing is in the ER nurses have a lot of autonomy compared to certain nurses on the floor. So we implement a lot of things without doctor's orders and things like that because they need to be done in an emergency situation. With that being said, overall, PAs, nurse practitioners, and physicians in the ER, they see the patient, they assess the patient, they figure out what we're going to order in terms of labs, imaging, things like that. I do not do that, even though I know what things need to be done. Once they receive those things, they culminate all of them and create a diagnosis and a treatment plan for this patient. I do not do that. So I just essentially at this point follow the orders that are being done for these patients. Now, obviously, again, the more experience you have in the emergency department, the more you get good with really identifying what this patient even needs before the doc even does it. So a lot of times we'll protocol certain labs or protocol images and things like that, depending on how the patient's presenting. But that's going to be the gap that's going to fill this. My level of care or how I treat my patients is going to be a lot more than what I'm currently doing now. So I'll be a lot more involved.
Okay.
With that aspect of it.
Yeah. Did you consider NP or nurse anesthetist? There's, some different routes as far as furthering your nursing degree. Well, and that, that's, I don't want to say it's controversial, but it's this huge debate of PA versus NP. And so I think you probably have more insight than others.
Yeah, I did consider, the first one I definitely considered was CRNA school. The second was MP school. And, the reason I didn't do CRNA is actually one of my letters of recommendation for PA school and for my nursing job I have now was an anesthesiologist. And I've shadowed him plenty of times. He's a good friend of my mother's. And I just didn't like anesthesia. I respect the field and, he loves what he absolutely loves what he does. But for when I was shadowing him, I didn't feel like that was something that I would want to do for the rest of my life. A lot of times they're taking care of the patients, they're under sedation. They're kind of doing one thing at any given time, just focusing one part of the OR. And I just kind of like moving around. I like the emergency medicine side of things. And so I knew that I didn't want to go to CRNA school for that specific reason. I just didn't like anesthesia. But it is a great job. Second was nurse practitioner school. And obviously going through nursing school, they're very biased about this. So, all the questions that we have on all of our STEMs revolve around nurse practitioners and doing things like that. And, the ultimate decision that I made in regards to that was that the educational differences. So I really sat down, looked at the educational pathway that nurse practitioners had to go through and PAs had to go through. And for me, I felt as if I fit more with what the PA education was giving, the in-person lectures, the medicine of everything, whereas a lot of my friends who are nurses are in NP school and they're typing a lot of papers. They don't like the fact that it's very nursing theory based. There's not a lot of medicine in it. And so that's kind of the decision that made me really start thinking, okay, nurse practitioner might not be the route, as well as the lateral mobility. So PAs, without a doubt, have a lot more, their lateral mobility is a lot easier than nurse practitioners. Nurse practitioners are catered to a certain population of patients, so adults or pediatrics. And so if you have an acute care nurse practitioner, they can't treat pediatric patients. So if they plan on being in the ICU, they can't come down to the ER because they're going to see pediatric patients and things like that. It's just really confusing, and I just didn't really want to get into that. So the PA education pathway fit more with what I wanted for one, And for 2, I just like the lateral mobility that PAs have.
Yeah, great answer. Okay, so it sounds like you were very confident in your decision, kind of knew what you wanted to do, which is great. What did your application process look like?
Stressful.
Of course.
Yeah. A part of me, so I've been planning this, right? So this is 5 years in the making. I've been planning this. And so finally I get to the time where I can apply. So I start picking schools and I start realizing, okay, I don't have organic chemistry, I don't have physics, genetics, so I can't apply to these schools. So like Yale, I really wanted to apply to Yale. Couldn't because they required genetics. And so I trimmed down my list in terms of what course or what schools I can actually apply to. Once I did that, then I started, using the resources that I had. So James Kim, one of the PAs.
He's great. Yeah.
Good friend of mine, lives here in Vegas. So I started texting him saying, hey, man, this is very confusing, Casper. I'm not sure what I'm doing. So he helped me tremendously. We met at Starbucks, talked about the whole thing, reached out to a few other people to help me, and started applying to all these different schools. And had a really good friend who I was actually taking a chemistry course with, who got accepted into the school that I just got accepted to. And he was kind of helping me, telling me what things he made mistakes on and things like that. And so pretty much my entire summer, we were going on vacation too. So I was, in Yosemite, and I would wake up early in the morning and I was writing personal statements and, or all the statements that they require you to do when you apply to certain schools. And I remember doing all that stuff, but I was just very stressed because a part of me knew that, hey, I have great experience. I feel that part of the P application, but I know my GPA is not better than a lot of people. I'm very average on that. And so I was really nervous that, schools would even contact me to do these things because, they want a well-rounded person. And one portion of my application was not that great. And so that was something I was really nervous about. And, I put myself on the internet. And so at the time I'm stressed out with that because I'm like, man, I'm not going to even get an interview offer, and it's all over the internet that I'm applying. So it was a really stressful process for me, but I really enjoyed it. Looking back on it now, it's funny, but at the time it was not.
Right. Yeah, no, I totally get you. And it's hard to understand unless you're the one going through it or you have someone else who's gone through it, because everybody else just doesn't really understand. But luckily it all worked out. How many schools did you end up applying to?
I think I applied to 10.
Okay. What were kind of your outcomes with interview invites and acceptances?
Right.
And
so I had I applied to 10 schools, and then I kind of knocked it down to 9 because one of them required a secondary application. I didn't do it. So out of the 9 schools, I had I think 4 interview offers. I interviewed at West Liberty. At University of Charleston in West Virginia, Reno in Nevada, UVU in Utah, and Loma Linda in California. And then I received an interview offer from University of New England, but I didn't go to that one. And then I received an interview at OHSU. So 6 interview offers, and I went on 5 of them.
Okay. And then what were the outcomes there?
Waitlisted at 2 schools, rejected at 1 school, and then accepted at 2.
Nice. So you had a choice. What came down to making your decision?
Location.
Yeah.
The location, yeah. It was a lot closer. So the only other school that accepted me was far on the East Coast. So, again, if it was the only school, I would have went to it probably. But I have family here, I have a girlfriend here, so I want to stay close to everything here. It was kind of a plan that my girlfriend and I made, so.
Yeah, makes sense. That was my top thing too, location. But during your interviews, did your nursing background come up? Did they ask about that specifically, or did that?
Yeah, they definitely did. And I think they found out before I would even interview individually with them, because we would be in, they bring you in a room and everyone's in there, everyone's talking, and then they'll have people, stand up and introduce themselves and tell them, where they're coming from and what their experience is.
Yeah.
I would say that, and the whole room would, turn around and look at me, and so they kind of already knew before I even interviewed individually with them. But it was definitely a talk of the interview process, in the interviews and outside the interviews with the rest of the applicants. So
yeah, I think it's just, and you tell me your thoughts, but I think it's just not that common because it is like, it's great experience, really, really great experience, but it's a longer route to get there.
Yes.
And so it's not the route that most people take, and so I guess that's where it's surprising, because they're like, oh, you actually know what you're doing. You didn't
very yeah
feed people in white butts.
There was one nurse in the interview as well, and then there was 2 nurses that were in the program at the time. And there's becoming more and more. So I was under the impression that I was going to be the only one. And when I went to Reno, there was a nurse in the interview process, and then they had 2 nurses in the program. And then same thing at Loma Linda in California, there was 1 nurse in the interview and 2 nurses were in the program. So, it's becoming more common, but again, like you said, it's an aberrant path. It's totally different. And so a lot of people don't hear that, and so they're very surprised when they about that.
Well, I think it's a good path, but all right, so what's kind of next on your plan? Are you thinking that you'll end up in the ER, or kind of open to see what that's going to be like?
I think I'm definitely trying to be open, but I think a strong part of me is going to be back in emergency medicine. So it's kind of what I know is what I'm good at. And, that's the thing, is that I don't have to stay there forever.
Of course.
So
yeah,
that's the beauty of it. That's why I'm really excited about it. So that I'm most likely maybe I'll change a few times. But my aunt, she's done emergency medicine, plastic and reconstructive surgery, cardiothoracic surgery. But she's moved around a bit too. So I hope in the future that, I'm sure, with the things, families changing and schedules and demands and family life, stuff like that, maybe I'll change around and see what works better. But as of right now, I think emergency medicine might be it.
Yeah. Is there anything that coming up with school starting, like, are you doing anything to prepare? Are you still working, or have you kind of taken a step back?
Yeah, I'm still working. Plan on working. The plan is right now, my girlfriend and I kind of planned it out that at the beginning of the month of September, school starts in the end of September for me. So probably the beginning of September is when I'll put I'll quit. I'll stop working. And, but I'm going to work up until then. And then in terms of preparing, I've just been relaxing. Before I got into nursing school, a lot of that question was coming around, what should we do to prepare ourselves? And everyone always advised, just relax. And now, having gone through it, I would recommend the same thing. So same thing here. I'm treating it the same way.
Yeah. Is there anything you're nervous about going into PA school?
Yeah. One, the academic load. So I've been out of school now for 2 years. So being transitioned back into that. And then 2, a thing that I'm very, apprehensive about is that is my clinical experience going to, mess me up when taking certain exams? Because, there's a huge difference when answering questions on how they're teaching you versus how you see it in the clinic setting. And I have a lot of experience now in that. And so I'm hoping that I can be able to put that aside and be a normal student like everybody else. So.
No, I think it'll only help you, for sure.
Yeah.
For sure, only help you. I mean, I went into school as someone fresh out of undergrad who had pretty much zero exposure to all the different medicines and all of that. Like, even, pharmacology is, to me, the hardest part of PA school. So the fact that you have some background in that, honestly, everyone always says that the nurses in their program, kill it and do great.
Yeah.
So
hopefully.
You'll do great. You'll do great. Well, where can everyone kind of find you and follow along on the rest of your journey?
Yeah, so I'm on Instagram now. I wasn't on Instagram through nursing school, so it's kind of a newer thing for me. I'm on Instagram now at Kaynen Brown. And then I'm on YouTube as well at Kaynen Brown. So you can find me on both YouTube and Instagram.
Awesome. Well, we'll link to all that so everybody can follow along with you.
Yeah, absolutely.
All right,
I appreciate you bringing me on. This was awesome.
Yeah, no, it'll be very helpful, I'm sure.